I must say that in my few years of experience, I've been opportune to really work more in the grassroots. Of course, I live in Abuja, but I have worked more in health facilities and visited, I think, over 2,000 now health facilities in the grassroots. I'm from Kano State, and this work has taken me around all the 44 local governments of Kano State. Some of them I never knew that people like that exist. To be honest, that is what gives me the passion to do what I do, because of what I see. And every time I go to the field, I feel that this country is a country that people say has a tale of two cities. In this hall, we just can't understand it. It's only when we get down to the grassroots, and many of us luckily have been there and have walked there and have come back and are sharing what we do. So without much of this kind of emotional discussion, I'd like to first of all talk to you about what SHOPS Plus is, because I've heard so many people say, what is SHOPS, and why Plus? So SHOPS Plus is sustaining health outcomes through the private sector, Plus because this is really a continuation of, or follow-on to a previous project, which is SHOPS, strengthening health outcomes through the private sector. It's a USAID-funded project, and I'm happy to say that we have our USAID colleagues here with us that have really given us all the support we need to do what we do. So for SHOPS Plus, really we recognize that at the community level, the gaps are so huge. We can't even start really kind of believing what we see in those kind of communities. So we have two projects, and I'll start with the first approach, which is the SHOPS Plus activity that works in strengthening family planning services. And the goal of that SHOPS Plus family planning program is actually to improve access to family planning or quality family planning in 4 states, FCT, Plateau, Akwa Ibom, and Oyo State. And when you talked about Plateau and FCT and the fact that just going 1 hour away from FCT within the Abuja, you will really understand that it is just a different Abuja. I don't know how we have done that. But to be honest, we, in our program, especially in the family planning program, we realized that health workers, especially in the rural areas, are one of the most important human resources for the health system, and the most important resource too for the health system. And if they do not have the required knowledge or skills or motivation or even attitude to deliver the best services that they can deliver, then we're sure that we are leaving a lot of our population behind. And what we see is that at that level, most of these health workers either are community health extension workers, you hardly find doctors, and even sometimes midwives in those communities, in those facilities. So we realized that what best than to work with the Federal Ministry of Health to implement the task-shifting, task-sharing policy in improving access to quality family planning services. So what we did was first to really try to build skills of providers in family planning, since that is the area that we support. But we realized that the skills were not only the issue. It was actually more of the attitude. Of course, some of these Jews had never ever seen any other family planning service delivery method apart from probably a condom or a pill. So you see where the problem lies. And we're talking about giving them wide access, giving our women and the community wide access to different methods of family planning. So it was a Herculean task to really ensure that both the technical content was really enhanced, but also to really put attention to the underlying factors of the gender dynamics and the attitudes of providers. So we enhanced the national curriculum with some of these exercises and some of these sessions. The aim was to ensure that whatever this training that we're conducting has to really focus on the provider's needs, has to focus on the provider's knowledge, and to ensure that this training helps them to interact better with clients, especially, for them to really stop that one-directional relationship with client, for them to be able to really relate well and provide balanced counseling to their clients. So really, we wanted to put the providers at the center and put ourselves in their shoes. But we also wanted to ensure that all what they do is to deliver patient-centered or client-centered care. So I just wanted to share a few stories of some of our providers. Helen is a community health extension worker in Plateau, and she actually works in one of the rural facilities. Interestingly, in her facility, even access to mobile network service is a challenge. She does not see anyone come to her facility to support her, especially, every quarter, ideally, there's supposed to be supportive supervision visits by ministries and agencies to go and see what providers are doing and to support them to actually do better, provide feedback and all. But the reality is that this doesn't happen always. So most of these providers that we work with have never seen anyone come to their facility to support them, to encourage them and to motivate them to do better. But Helen came to one of our trainings as a community health extension worker. And one of the first things she wanted to do was to leave the training because she just felt that this was too highfalutin for her. But when she started, she realized that, maybe she could have an opportunity and a chance. And the trainer, so as part of our trainings, we actually build or strengthen relationships between these trainers and providers. So one of the trainers that was actually part of the training recognized that Helen had these issues, she wasn't confident. And when he started talking to her, she just, informed him that she will just go and provide the services that she can deliver. But with the support that Helen needed, with the motivation, the trainer realized that she could do it. And actually, he supported her. He conducted post-training follow-up visits to to her facility. And the interesting thing is that sometimes Helen goes under this tree, where it's the only site where she can receive network to call the trainer and to discuss with him happily that, I've been able to insert an IUD today, and I've been able to do an implant insertion. So I think that communication also between us and maybe higher level providers and those that are in the communities is really critical. They need the support. They need us to motivate them. This is Rebecca. As I said, in addition to the clinical or technical skills, we seriously consider the biases and the attitudes that providers have as one of the issues that affect the implementation of quality health services in this country. So Rebecca, after her training, realized that she had a lot of biases in especially family planning, ensuring that either young women or women that were unmarried. In fact, Rebecca told us that if you did not have 3 to 4 children, she doesn't think that you should come for family planning. So that was how she felt, when she came. But currently, she changed her attitude and realized that the quality of care she delivers is actually very much related to the values and the beliefs that she has that affect the services that she provides. So we actually helped her to identify those biases and understand that she should not, as a matter of rights, ensure she should not allow those biases to affect the services that she provides. One of the other things that we did, because as I said earlier, these health providers need continuous mentoring and support because what they face at the grassroots, we would only imagine. So we supported them to develop a very easy mobile phone enabled, what we call audio job aids in collaboration with Viamo and Airtel. So right now, all these trained providers, using a very simple phone, can dial 321 and actually access audio job aids on family planning just to reinforce what they have learned. And you don't have to have data to do that because we know that there's very hardly any data access in those areas. And in addition to every week, whichever phone you have, no matter how simple, we have developed a mobile curriculum. And every week we call them, with an automated messages. They are IVRs, that is interactive voice messages, which calls them to just give them a 2-minute curriculum on family planning, just to remind them on some of the things that they have been trained on. So really, we have to find very innovative ways to reaching these providers at the grassroots and at the community level, so that they will continue to be part of the whole system of improving quality. And we'll be happy to really share that so far, especially in our 2 states, this is one of the first results that we achieved. In the 2 states of FCT and Plateau, we were able to train over 450 CHUs. And these CHUs have actually been very instrumental in improving access to family planning services. And now we have seen that more than 48,000 new users have accessed modern family planning methods in the 2 states. You can see where we started. In May 2018. And within a year, there has been a high access to family planning services. So now going to the next activity. In Lagos and Kano, the Shops Plus project works in improving TB outcomes, that is supporting the National TB program to really ensure that patients that are found to have presumptive cases probably of TB move from testing down to treatment, and for us to ensure that they are on their pathway. But we noticed that, especially in Lagos and Kano, the private sector delivered most of the care in Lagos and Kano, especially for such kind of cases. And when I say the private sector, I mean different cadres of private sector, from patent medicine vendors to community pharmacists to the labs themselves, and also to clinics. So it is a very complex system, because most of the clients just first of all probably go to a chemist when they are coughing. So as a private sector focused organization or activity, especially for our TB activity, we recognize this role of the multiple cadres of this private facility. And we felt that if any TB program is going to succeed, they needed to fully incorporate these providers. And probably because in Nigeria, we don't incorporate them well, that is why it's only 1/4 out of the estimated 400,000 cases of TB that occur in Nigeria are actually identified. So there's a lot of missed opportunity in that area. So we actually focused on a patient pathway, looking at the patient rather than the provider. So if a patient comes, where will they be tested? Where will they be screened? Where will they receive their results? And where will they get treatment? So we developed a network of providers that will help them to target really on the patient. So this is actually more of patient-centered and not the facility-centered. So if a patient now comes to a clinic or a PPMV and it's identified that that patient is probably a presumptive case, they will take that sputum there and then they will be responsible for moving that moving the sputum actually to the lab and bringing it back, and then communicating with the patient that this is what the results is all about, so that we reduce that challenges of the patient themselves moving up and down. And we have heard that with this movement, we usually lose cases to follow up. So what did we do? Because these are private providers, we realized that we could actually make work easy for them. And paper-based reporting was a huge challenge because they already have too much on their plates. So focusing on this patient pathway, we actually developed an app. That's the TB Star. We called it TB Star. And TB Star is TB screening. So TB screening and tracking for accelerated referrals and reporting. So with this app, it's easy for them to download it on their phones. So this is really not for very, very rural facilities, of course, as you can see. So when they download it on their phone, the moment a patient's come in, they are able to register the patient and kind of put in the data, and then wherever the patient goes to, this data is already uploaded. And the labs themselves are also able to upload the data or the results if the results are ready, and then the provider that included this patient or registered the patient is also able to check up the results of the patient and then also communicate with the patient. So the most important thing is having this TB Star app, and as I said, there's a network. So we have a network of providers, and this network, some of them are in the network, but then we know that there are also independent providers. So for independent providers, there's an app for them also, the same TB Star, that is for anybody. And I must say that in our booth, in the Shops Plus booth out there, we have our team ready and able to really help you to download this app so that you will have real-time experience on using this app. So really, what we have done is to ensure that we have enough people in Lagos and Kano, that is mostly the providers in these multiple cadres, that are able to be trained. So they were trained and they are now able to deliver quality TB testing, screening, and treatment. But most of all, what we'll say is that what we have realized at Shops Plus is that health workers are really critical in improving the quality of health services. And we know that if they are properly motivated and they have the right skills and attitudes especially, we believe that the quality of healthcare will improve, especially in rural areas. And finally, if quality of healthcare is actually improved, from here we can see that mothers will survive, children will thrive, families will prosper, and communities and societies will definitely develop. Thank you very much.